yesterday when he came home. I was like, it's you. It's you. Then here, as soon as there's an outbreak in Guam, you're on.
The March 4th meeting of the Thousand Oaks Council on Aging is called to order. Will you join me in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We will now have the roll taken by Staff Liaison Francine Spriegel.
Thank you. Please stay here, present when I call your name. Chair Maria.
Here.
Vice Chair Mortimer.
Present.
Commissioner Stephen Allen.
Present.
Commissioner Stephanie Belding.
Here.
Commissioner Jeffrey Burt.
Here.
Commissioner Tony Gitt.
Present.
Commissioner Rosanna Guerra.
Present.
Commissioner John Posta is absent. And Commissioner Karen... Oh, no, he's here. I'm going to say here for him. And Commissioner Karen Sylvester. Thank you.
Okay. Item 4 on our agenda is public comments. At this time, I do not have any public comment cards. And so we'll move on to item 5, which is the census update. Item 5 on our agenda is the census update. We are going to be joined by Justine Fisher, who's a partnership specialist with the Department of Commerce for the 2020 census. And she's going to be giving us an update on the upcoming 2020 census. And she will be supported by Dusty Russell, who's the economic development analyst with the city manager's office.
So good afternoon, everyone. Thank you for having me. As a partnership specialist, my role is to work with city and county governments, houses of faith, community-based organizations, schools, and other community service organizations to talk about the importance of the census and why it affects everybody here. And so we're going to do a run-through of what is happening with the 2020 census. So the timeline for the census is that it's coming very quickly. It will be received in people's mailboxes. If you have a residence that receives U.S. postal mail, you'll be getting an invitation to respond in between March 12th and March 24th. It will ask you to respond by the end of April. After April, enumerators or census takers will be walking around everywhere trying to get everyone else counted who has not answered either via internet, phone, or on a paper form. The count is so important because what it does is it does multiple things. It definitely has impact on everything that we touch here in the city and in our county. It has $675 billion in funds that gets proportioned. There is also apportionment issues for our congressional representatives and others. And so when if we don't get a count of everybody or populations are hard to count, then we lose out on those funds. We lose out on apportionment. We lose out on everything that the census data provides. And census data is a premier source of data for everything that is done, not just for governments, local and national, but also for businesses and other organizations. We're going to be talking about filling out the census and resources as we go through. So again, here's your time frame. You get an invitation for March 12th to 20th, and then a reminder letter, because we know sometimes it ends up somewhere that you don't want it to end up, like your recycle bin or in your stack of things you have to answer, because we all have very busy lives. And then if you haven't responded, again, a numerator will come to your house late in April all the way through July. They have that time to make sure that they get everybody counted. There we go. Just want to remind everybody of the ease right now of all the abilities to answer, because you can go online and answer. You can use a phone. You can call someone at the Census Bureau, or you can do a paper form. Online and in the when you call someone, there's 13 languages to choose from, whatever is your most language of comfort. So there's plenty of opportunities to make sure to answer. So all the data that we collect, as I mentioned earlier, is very important. reapportions our seats in Congress. There's only 435 congressional seats. In 2010, Nevada picked up one. It was the fastest growing state. And Wyoming lost one. So that population count is very important. It updates congressional districts and boundaries. And as you know, we recently had a law change where it also changes how school districts and city councils are voted upon, breaking down cities and areas even into smaller subsidiaries, so the population counts for that. It's the $675 billion annually in federal funds that go to local communities, and we want to make sure here in California and here in Ventura County and here in our city that we definitely get the annual amount of funds that we would like of that $675 billion. And I'm going to ask Dusty to come up and sort of talk about what's really happening here in the city of Thousand Oaks.
Thank you, and good afternoon. I'm going to focus a little bit more on Thousand Oaks, but first, I wanted to touch a little bit more detail on what exactly the census impacts, the different types of funding. The funding can impact libraries and schools, hospitals, roadways, and various other items that are listed here. Over 70 different federal programs rely on census data to inform the distribution and allocation of funding. So I wanted to call attention really quick to this figure at the bottom here. The federal programs, they distribute more than $675 billion annually in federal funds to local communities. Our portion of that in Ventura County every year is $1.7 billion. So there is a risk of undercounting. And so what does undercounting look like? What are some of the factors that may influence that? There's several of them, but you can kind of categorize them into a few different ways. They have to do with race and ethnicity, housing situation, income, veteran status, age, and a series of other factors. Something to note here is that each individual that's uncounted, they've estimated that the losses in federal funding for a locality amount to about $20,000 over the 10-year period before the census is updated again. So quite significant. So what does it look like here in Thousand Oaks? They've put together something called a hard-to-count map, and they've assessed for many of those characteristics that I mentioned before, and they've kind of quantified what census tracts are currently hard to count. What's great about this tool is you can really zero in. You can get very close and see even subparts of the census tracts. But here is an overview. We have 3 areas in our city that are considered technically hard to count. And so as a portion of our population, that amounts to about 15% of our population. So that's about 19,500 residents that live in these 3 census tracts alone. And that's not to say that there aren't hard-to-count populations elsewhere. It's just here. So what does that look like in terms of money? A failure to count 1 out of 10 of these individuals that live in this area could amount to $3.9 million less in funding annually, or over 10 years, $39 million. So what's the city doing to help? I tried to categorize this kind of simply, but here at City Hall and at our libraries, we're going to have stations where folks can ask questions and fill out the census. We have lots of physical information displays available at all the sites. We're using our websites, various newsletters. So the city has multiple newsletters for certain people interested in certain topics. We also have wastewater billing. We're looking at that as an option to send out information there. And we have social media. We also put together an event in early February where we pulled together more than 30 community-based and faith-based organizations to help coordinate our efforts and sort of leverage resources and help with planning. And so now I'll turn it back over to Justine.
So this URL, 2020census.gov, is like the hub of everything census. It's a place where you can find plenty of information. There's information here if you are interested in looking to see what's happening, if you're looking for information to share with others, if you want to get in your own email box, email blasts every day from the census that tell you what's happening. Or actually, my favorite part is looking up what's called the America Counts stories. And they're just stories about people all over the U.S. and its 5 territories. It's just a really great view of all the different types of people and who's living in our country and in our territories and what their lives are like. So I really suggest that if you are interested in learning more, you can go on there. There's plenty of resources, plenty of information. That will also be starting when our census information invitation goes out. March 12th, you can go to 2020census.gov and there'll be a button that says answer here. And it'll take you to the website where you can self-respond to the census. So it will take you to a new website, again, that will have a banner across the top that says click the language of your most comfort, and you'll be able to answer the census. So here's some other places that will have places where you can use a computer to answer the census in City Hall, at the Service Center, at both of the libraries, at the supervisor's office, and at the urgent care. They can answer some questions for you. Also within Ventura County, every single library in the county is a host of a kiosk to answer. The Ventura County Library System's mobile kiosk will be going around also, so they may have a time here also in Thousand Oaks. And of course, any other city or county office is available. So if you find yourself somewhere outside of Thousand Oaks and you're thinking, I really needed to do this today, where can I go? Any library, any city government office, and many schools as well. So here are all the ways that you can learn about this. So much information. 2020census.gov is there. If you click on that URL, you can also look up for partners. So interesting information, educators, what schools can do, and other information. Ventura County, the County of Ventura, has a really great website also. It's census.ventura.org. And Ventura County's Complete Count Committee, which is an overarching group of many, many agencies and all city governments within the county, VenturaCountyCounts.org. You can also sign up through VenturaCountyCounts.org for social media or email blasts to come to your social media accounts. So there's plenty of opportunities. At Ventura County Complete Count Committee at VenturaCountyCounts.org, you can also sign up to be a volunteer. Volunteers are going to be necessary. We have a lot of work to do and a lot of places that might need assistance in disseminating information or sharing information, and so that's another opportunity there. So do you have any questions?
Does anybody have any questions? Jeff?
Hi, thank you for the information. I know, is the hiring process for census workers over? I know there's a number of seniors who may be interested, and I know they've actively been recruiting, so is that still an opportunity? It's
not over. It's a very long and arduous process, and it takes a lot of time. And they've only recently started calling people for enumerator jobs. They first had to fill field positions and the Camarillo office. But you have to just be patient because we have to remember that they're hiring thousands and thousands and thousands of people, 500,000 people. And so it's very slow. And not everybody, obviously, who has applied will get a position. Not everybody passes the screening. Not everybody's capable of serving due to other things. And so it's just a really long process, and I wish it was shorter.
We're not able to take any questions from the audience, but once the presentation's over, you can talk to the presenters. But otherwise, we can't take questions until the meeting's over. But I can ask the Commissioner Belding, you had a question?
I did just have one question. I actually went online to look at all that. It was really fascinating and wonderful. The only thing I had a question about, I looked at that mapping area for the hard to count, and even after living here for so long, I couldn't really figure out where those areas, what that was indicated. I don't know how important it is for me to know that, but will that be the area that we most anticipate people will be walking? You know, our census takers may have to do more follow-up in those areas. Why are we keeping track of that, I guess?
So in what we consider hard to count areas, and there's 3 ways you can access that. The Federal Census Bureau has Rome, which shows its census tracts and hard to count. California has broken that down into California, which you can only access as a member of the California Complete Count Committee. So that's mostly county and city governments. And then here in Ventura County, we have kind of another sword that even breaks down the county more. The point of having that really is so that we know, those of us who are working, places we really need to coordinate special effort. Places that me as a partnership specialist, I really need to look for businesses or houses of faith or schools. However, what will be ending up happening is once people start responding to the census, those tracks may change. And what will happen is we'll have what's called, for about a 6-week period or longer, what's called mobile questionnaire assistance, which means that as we're tracking real-time data that says, hey, there's an area in Thousand Oaks and nobody's answering, or less than we anticipated, partnership specialists go find a business or a school there. We're going to arrange to have mobile people there to help people respond. Before enumerators. That'll go on through July, but that's trying to get people to self-respond first. It's the safest, it's the fastest, it's the easiest. After that, they will say, okay, we're going to now need enumerators to go out to whatever area it's actually whoever hasn't answered. So even if you're in an area that's super fabulous and 97.9% of your neighbors answer, but the rest don't, a numerator has to go, by law, knock on those doors 5 times. If they can't reach you within that 5 times, then they need to talk to your neighbors about you. And I'm not kidding. They do. They have to talk to your neighbors about you so they know how many people are living in that house and a guesstimation of age. And that's not a Census Bureau requirement. That's the law. And this is a constitutional law. The census is constitutionally required by every person who resides in the United States and its inhabited territories.
I'm glad you said that.
Thank you.
I had no idea about the neighbors.
Do we have any other questions?
Yeah.
Steve?
Thank you for this presentation. I have a question on the importance of the data that you're collecting, and the question is, do you extrapolate from this data, or maybe asked another way, to recoup our tax dollars and bring them back into our community? Is it only on the hard data that you do collect that you qualify what percentage, and it is a very small percentage of the federal budget, that comes back into our community?
So that data is used, and again, I just want to clarify, it's data. It's not anyone's name or personal information that gets delivered by anyone. The Census Bureau cannot share that information. It's just extrapolated data, percentages and statistics. And it does determine on federal funds and how they're dispersed based on population. And not all federal funds are dispersed the same way. And it depends on the agency and other regulations. But it does mean that is what is coming back to us, for lack of a better way of explaining, is the money we've sent to the federal government and back. But the state of California will also be using that data for state services and state-controlled information. So that is much more internal, but it's still also based on the census data of population that we collect, and how important it is that you do say an age and a birth date. It is definitely super important to make sure we know the age, both for our oldest population and our babies, our youngest population, because they receive different services. So that is really key. And I'm just going to tell you a little funny thing about the census is it asks you on the form your age and your birth date, because they need to check, because people sometimes write one age with a different birth date. So if you want to be older or younger, I suggest you correlate your birth date to your age that you list. But they've noticed over the course of time that there's a percentage of people where those don't match, and they take the birth date age.
Interesting. Are there any other questions? Okay, well, I want to thank you, Justine and Dusty. It's a very important topic. lot changes in a decade, and we want to make sure that we have accurate representation. And it sounds like it's easier than ever to fill it out with all the online and the phone paper. Let's all avoid getting 5 knocks on our door and get it filled out.
Thank you.
Thank you. That's right, 3 knocks. Okay, so the next item on our agenda is item 6, which is the liaison and agency reports. 6A is our Global Adult Community Center report, and I would like to ask Commissioner Posta to introduce this portion of our meeting.
Yes, we have here today, we have here today Patty Duke, who's the director of the Global Adult. Duke. What did I say?
Patty Duke.
Patty Duke. Oh my God. Patty Ham, director of the Global Adult Community Center. And she is going to tell us about the wonderful things that are going to happen this month and coming months at the wonderful Global Adult Community Center run by Director Patty Ham.
Thank you, commissioners. I remember Patty Duke. I remember watching TV with with her on there.
You look like her.
Oh, I don't think so, but okay. So March is a busy month for us. In March, we have next week, Wednesday, March 11th, we are going to have a Lucky Charm breakfast, a St. Patrick's Day themed breakfast for our seniors. The cost is $7, and it's from 9 to 10:30, and we'll have a variety of yummy foods, some green, some not. Corned beef and hash and eggs, potato pancakes, some Lucky Green quiche, and some yummy desserts. And then afterwards, we're going to go out for a scavenger hunt with our seniors and see if we can get lucky and find the pot of gold at the end of the rainbow. So it'll be fun. There's still tickets available. And on Friday, March 13th, from 1:30 to 3, the DMV Senior Ombudsman will be coming to Global to talk about real IDs and if you need one, which I think you do. And she'll be talking about the new law that goes into effect October 1st and everything that has to do with the real ID subject for seniors. So any seniors out there who haven't gotten their real ID yet or have questions or need to know, are confused about what documents you need to get that, she's going to be there next Friday, March 13th. I suggest you come and join us. And then on the same day, March 13th, we're going to celebrate St. Patrick's Day with a Shamrock Shindig, with a dinner dance, live band, corned beef, soda bread, cabbage, potatoes, photo booth, and some games and dancing, and that will be from 5 to 7, and that is $10, and there's still tickets available. On Sunday, March 15th, our Global Senior Center Commission will be presenting Music Comes Alive, Everly Brothers Tribute Band. Now that event is officially sold out, but we will be selling at the door tickets for those who don't show up. We typically do have some no-shows, so if you want to take a chance and come, you're an Everly Brothers fan, come in and see if you can get in with the no-shows. That's $7, Sunday, March 15th from 3 to 4:30. And then on Friday, March 27th, our Global Senior Center Commission will be having our Friday night bingo. So I think that's a good time for the COA to get together and have a little adventure and have a little bingo night. I think you guys, some of you, or one of you at least, was lucky last time you came. And bingo starts promptly at 6:30 Friday night, March 27th. And then you probably have already heard, but I'll just make an announcement real quick. The Global Center is going to be closed for a week in March, from March 16th to 20th, due to the replacing of our flooring. It's been about a year since we got new flooring, but unfortunately, it didn't stick. So the manufacturer is replacing it for us. So we're excited about that, and hopefully it sticks for many, many more years. So that'll be March 16th through 20th, and we have signs all over the building and have been notifying our regular patrons. But we're excited to open up on the 21st. And that is it for the Global Center.
That is wonderful, Patty. You don't have to be Irish, do you, to come to those events, do you? I didn't think so. Anyway, do you have any open dates? Because you filled up everything, I think. It's wonderful. There's always something happening at the Global, so stop by any day, and you'll find something really wonderful to do.
Thank you,
Patty.
Thank you, Commissioner Costa. Item 6B is our Canao Senior Volunteer Program, and I'm going to turn it back over to Commissioner Posta to introduce the CSVP updates.
Okay, we got Julie Spivak here today to tell us all about she's a director of the Canao Senior Volunteer Program. They have a whole bunch of interesting opportunities for you to volunteer, and she's going to tell you about some of them. Julie?
Thank you. We do have some great opportunities coming up that our local partner agencies have to offer in the next few months. The Hospice of the Canao 2020 Golf Tournament. It's the 33rd annual charity golf tournament, and it will be held Monday, May 18th at Sunset Hills Country Club. Volunteer opportunities include putting together goodie bags, collecting money, helping with the silent auction, and more. The Senior Concerns Love Run is looking for volunteers for its annual run taking place in Westlake Village on Sunday, June 7th. Sign up to volunteer for numerous opportunities, including goodie bag stuffing, packet pickup, info booth, and check-in help, or to be a course monitor. And that is always a super fun event. Also, the Westminster Clinic, the Westminster Free Clinic has been providing free healthcare services to the uninsured population in Thousand Oaks for over 20 years. And they are proud to announce the opening of their new location at 1800 South C Street in Oxnard. If you're interested in volunteering at either of the two locations, openings include medical and non-medical positions such as doctors, nurses, scribes, and food volunteers. So those are just a few. We have a lot of opportunities. We have about 70 partner agencies that we help send volunteers to. So if you are interested, call the CSVP office at 805-381-2742, or you can come pop in and say hi, and we are located in the Global Center. Thank you.
Thank you so very much.
Thank you, John. Item 6C will be deferred to a later date. We're going to move on to item 7, which is Commissioner Reports. At this time, I'd like to ask Vice Chair Mortimer to introduce this section of the meeting.
Thank you, Chair Maria. The Council on Aging researches a number of items of interest to seniors throughout the year. I will introduce commissioners who will provide current updates. Item 7A, tax scams. Commissioner Burt, would you please give your report?
Thank you, Commissioner Mortimer. Hi, I'm Jeff Burt. I'm the commissioner, one of the commissioners here, and I'm going to talk a little bit about tax fraud. And you're probably all very sick of getting those calls on your cell phone, and now they've started to identify them as potential spam. But it's everybody's favorite time of the year, next to Christmas and Thanksgiving and all those good times. But there are many, many, many scams going on. And remember, you will be a target, but you don't have to be a victim of a scam. The official date to file your taxes is Wednesday, April 15th, 2020, of course. Scammers are impersonating agents of the IRS by phone. They insist you have an unpaid tax bill. You must pay immediately or face immediate arrest. Those are all kinds of red flags. In addition, over the last 3 years, believe it or not, 8,600 victims have lost $47 million or more, and those are staggering numbers, and that number comes from the U.S. Treasury and the IRS. Older Americans are prime targets, of course, of scammers. calls can appear that they come from an IRS department, and you may have seen that on your own phone where it might say IRS or Apple or some other trustworthy source. That's called phishing. And one of the things that you really should remember is that they may even have your Social Security number, and you wonder, well, how would they have your Social Security number? Well, they have it. And moving on, the number one warning sign that you may be a target of a scam is the IRS is only communicating with you via the mail. If it's a phone call, immediately hang up. There are some do's, some don'ts. Hang up immediately. If you get a call and you see it says IRS, it's not going to be from the IRS. It will be from a scammer. Forward unsolicited emails to the IRS or Treasury. Consider putting fraud alerts. They're pretty easy to put on your accounts, and it's suggested you can actually do them online or call your credit card company. Do ask for identification if you're visited. Now, sometimes they may come to your door, and if they do, you should obviously ask for identification. Actually, any IRS agent will carry two forms of identification, and not to get into the minutia, but they're called HSPD-12 form and the Pocket Commission. HSPD means Homeland Security Presidential Directive, and the Pocket Commission is issued by the IRS to all of their employees. So those are two, and they will have photo IDs and they will have phone numbers. What don't you want to do? Obviously, you don't want to pay something that you don't owe. And so never provide or confirm personal financial information over the phone. Never, ever respond to texts or emails purported to be from the IRS. Never pay a tax bill with a prepaid debit card or wire transfer. Once you do that, the money is gone. It'll never be recovered. Never give a credit or debit card numbers over the phone. I think these are pretty much commonsensical kinds of things. And one thing, as I mentioned before, scammers can rig IDs to impersonate an actual IRS phone call coming in. Never be bullied over the phone. Request a formal bill to be mailed to you. The IRS does have your address. And remember, they should know where you live. Real quickly, the Canao Senior Volunteer Program, they actually provide tax assistance. Actually, there are 2 locations up until April 15th. And if you're a senior over age 60, any age in terms of over 60, and if you're making, it doesn't matter how much you're making, you can get tax assistance. People with incomes of $56,000 or less can also get help. And I'm going to show you there are 2 locations right up there. Canao Creek South, Monday to Friday, 5 days a week, up until April 15th, 8:30 to 4. And the Newberry Park Library is only on Wednesdays, though, 10 to 4. And those are the addresses. And if you call the Senior Volunteer Program, they will give you a list of what you need to bring. Thanks.
Is this at the library, the Canao Creek South?
We're not able to take questions from the audience until the end of the meeting. The reason is it's a televised meeting and no one else can hear. It would just sound like dead silence. So we have to wait till the meeting's over.
Thank you, Commissioner Burt. Item 7B, health. Commissioner Guerra, would you please give your report?
So my name is Rosanna Guerra. I'm the commissioner, and my area of expertise, or what area that I'm going to be speaking on in the coming months, is on the area of health. So I hope that you were able to see my presentation last month where I talked about fall prevention. So I wanted to talk a little bit about small changes that we can make, not only to how we handle health, but I'm going to also talk a little bit about nutrition. So to follow up on fall prevention, just in terms of small changes that you could make, I wanted to talk about the fact that the Ventura County Area Agency on Aging has classes on fall prevention. So if you want any further information about how you can educate yourself around safety issues and missed my presentation last week, please give them a call.
they can give you more information about how you can be safe around that. The other small suggestion that I have about fall prevention is something that we talked a little bit about, wearing shoes around the house, or wearing, being careful about what you wear as far as shoes or, socks. It's very important that if you are walking around the house, to wear something that does grip. So no flip-flops, but a really good sturdy shoe. And that should help with in terms of stability and reduce the amount of risk you have to falls. Now, on just a brief topic that I want to bring in again, the idea of small changes. So I wanted to highlight a little bit about nutrition. And that does kind of fall into the idea of fall prevention, because if you do have a nutritious diet, that might, prevent in terms of fall, because you are healthy, you have a nutritious diet. So I know some of us might have restrictions on our diet, and they might have restrictions in two areas. You need to take a look at your sugar intake, and you need to take a look at your salt intake. So one small suggestion that I have is, when you go to the grocery store, take a look, especially when you're looking at processed food or packaged food, at the nutrition table. Don't necessarily, a suggestion would be not to necessarily look at the calorie intake, which is what we've been kind of customized to look at, but scan the table directly at what the sugar is, the sugar value is, and the salt value. And then you can make a more educated decision about whether or not you want to purchase that. So salt and sugar can really be hidden. So something that you think you're looking at something and it's low calorie, and then you look at the sodium value and it's, way up there. So sometimes sugar and salt can be, fairly hidden in our packaged and processed foods. Next month, I'll speak a little bit more about nutrition referrals in the Canao Valley area. So thank you.
Thank you, Commissioners. I will now turn the meeting back over to Chair Maria.
Thank you, Vice Chair Mortimer. Our next item on the agenda is item 8, our guest speaker. Just as a reminder, audience members are not allowed to ask questions until the meeting's over. At the end of the presentation, our commissioners may ask some questions, but if anyone in the audience has a question, wait until the meeting's adjourned and you can speak directly to our speaker. At this time, I'm going to ask Vice Chair Mortimer to introduce our guest speaker for today.
Thank you. Victoria Jump is the director for the Ventura County Area Agency on Aging, known as VCAAA. Ms. Jump holds a master's degree in public administration and has been with the County of Ventura for over 18 years. As a subject matter expert in the aging industry, Ms. Jump has witnessed the challenges older adults and persons with disabilities face and is committed to providing services to those populations and their caregivers to connect them to resources that can make a meaningful difference in their ability to improve and or stabilize their individual situations and maintain their independence. Please welcome Victoria Jump.
Well, thank you for the opportunity to come in, talk about my favorite subject, older adults and people with disabilities. So just a little bit about us. And I'll go through, the role of the AAA, some demographics of why we're doing what we're doing and what we're looking towards, talk about the advisory council, what the goals of the agency are and objectives, what we're trying to accomplish, and then go into more detail about what we actually do in the programs that we offer and what we contract out. So we are a county-based area agency on aging. We have a staff of about 45 right now. We have 80 volunteers that we work with on a regular basis, and some of those are, a couple hours a week, up to people that during open enrollment for Medicare volunteer 40 hours a week for us. And our budget right now is about $8 million a year. So we have a specific role under the Federal Older Americans Act of what we are supposed to be and do for the community. And AAAs are a nationwide thing, and so you'll see them in every community. In some of the rural areas, they'll have one that will serve multiple counties. But our geographic area for us is Ventura County. So our role under the Older Americans Act really is to provide the leadership in addressing any issues that relate to any older Americans, older Californians, really any resident that's here over the age of 60. That has since expanded to really people that are younger, people with disabilities, including children with disabilities. I like to say we're a birth through death agency because of some of our youngest people that we provide comprehensive case management for, are children 2-3 years old. And our oldest person, I believe, is somebody in Ojai that's 107. So it's the full range. So we provide the leadership, but we're also tasked with developing really the community-based systems of care that really provide people with the choice and the options to live at home. It'd be really easy for the government just to build a bunch of nursing homes and have people live there, but most people don't want to live in a nursing home. And we believe that, there's value to nursing homes, and some people would rather live there than with their families. So we have to maintain them. So we're always looking at making sure that we are building something for the future, not necessarily for the right now. If we're building it for the right now, we're too late. So we need to think into the future and try to figure out, what does the demographics say? What do people say that they're going to need in the future? And try to set up our system so that we meet those needs. We're also tasked with making sure that we enhance and support our existing system of care, because it's important. We don't want to be a county agency that comes in and does everything. I think we're stronger with having nonprofit partners that we can work with. And so we really work to try to lift all social service agencies that are providing services to older adults and people with disabilities. And I think most importantly, and this is how we're somewhat different, we're set up as a different system, is that there's so much focus on making sure that older adults and people with disabilities are actually involved in the process, so that we're not coming and telling you, it's not the world according to me and what I think you need, because I'm not an older adult and I don't know what it feels like to be an older adult, and I can't anticipate what all of the needs of older adults are. So we make sure that we do have that citizen involvement, and that comes primarily through our advisory council, the committees that we have. We do a lot of surveying, focus groups, so we really try to get what the people say they want, because otherwise it would be a world according to me. So these are some of the demographics, so hopefully everybody can see this, that we're looking at. We've always known that there would be a point in time where the number of people over the age of 60 were greater than children under the age of 18, and that has hit this year for the first time. And this is not unique to Ventura County. This is nationwide. You also see this in other countries. As a result of the declining birth rate, now you have fewer people that are going to have to support a much larger aging population. So you can read the paper and they talk about, we're not going to build an extra school in this area, and that's because there is a declining school enrollment, declining birth rate. That's not to say that it's not going to change in the future, but right now older adults they're outnumbering younger people. So I say, yay. So congratulations. So for right now, we know this year, older adults are about 24% of the population. In 10 years, that's going to go up to 29%. By 2060, it'll be 34%, and then it's going to hover around that range. It's not going to change much. So, over the past couple, decades, older adults are now, we're here, you're noticed, and you're here to stay. And so unless people start having a bunch of kids, but also, it's a good thing, but it's also, as we're always looking to the future, it's something that we have to be concerned about as well, because who are going to be the caregivers for all of these older adults? The younger people. And if we don't have enough younger people to provide the care and the services, then that's a potential issue. Okay, so our advisory council. We do have a large and robust advisory council that I work with regularly. The city, you send 2 members. You actually have 3 representatives, which is great. So our advisory council has set up really to be the community-based advocates for people over the age of 60. That has since changed, and now it's really adults with disabilities as well. There's 30-plus members. With the recent bylaw changes, I believe we're up to 38 members now, 38 or 39. They represent the Board of Supervisors, all of our cities, service providers, as well as what we call focus populations. And those are groups that typically aren't part of discussions. We somehow leave them out, not like intentionally, but it just happens. So we have, representatives from mental health community, the disability community, the LGBTQ community, caregivers, and those are some of our focus populations. So they are, as they know, they're very involved with assisting us in creating and sustaining programs that allow people the choice to live in the community. We do ask that they participate in committee meetings. Sometimes we have task force groups. And really we want to talk about issues that are specific to that individual community, because we want to know what's happening in every community. But we also talk about larger things of county concern. So sometimes a problem in one community can turn out to be a problem everybody's having. And so it's something that we need to address. So as I mentioned earlier, we do have a strategic plan that really guides what we're doing and where we're going. We have scarce resources, and so we want to make sure that we're really using the money in the most, efficient manner, because we are accountable to the taxpayers for the dollars. But it also, I think it keeps us on track, and so we all agree on what these goals are, what our objectives are, and it keeps it from, the new interests of the day popping up and, derailing what we're doing. So one of our goals, we have our strategic plan is quite simple in that we have 2 goals. One is to provide the resources and services to older adults, adults with disabilities, caregivers, that promote optimal well-being with an emphasis on wellness, safety, and community livability. Our other goal is to increase awareness of programs and needs that support older adults, adults with disabilities, and unpaid caregivers, to include providing tools, classes, and assistance with enrollment. So under those 2 goals, these are our objectives. And you'll see these naturally align with the programs that we offer and the services that we contract with for. So transportation, is a huge issue. And so we want to help and provide transportation to ensure people have access to be able to fully participate in the community. We care about food and nutrition and want to make sure that people not just have food, but it's nutritious food, that they have nutrition counseling if that's what they need, supplemental food as well. Socialization and I guess the prevention of loneliness and isolation. It's a huge problem with really an impact on health. So, many things can cause it, but we really want to, to try to figure out what we can do, how we can assist. So we're trying to provide services really to reduce that isolation and provide a human connection. The biggest prevention of loneliness and isolation program is the congregate meal program. And you know, when it was originally set up by the federal government back in 1965, it had nothing to do with food. It wasn't, oh, people are hungry, we need to feed people. It was more about the social isolation, was the social isolation that was recognized back then, and it was creation of a congregate program to get people out of the house and in one place where they could talk over a meal. We also, we care and we're working towards prevention of abuse and protection of rights for older adults. Housing is another big issue. And providing information and resources. I'm really, trying to do it's an easy, uniform, streamlined system that people know what's available in the community. And we know that this is one of the biggest things that we have worked on for the longest time, but we continually have, we've been a county agency since 1980, but a lot of people are like, we never knew you were there. And so this is something that we continue to have to work on, as an agency. So to accomplish all of our objectives, we have a lot of direct services that we provide as an agency and also things that we contract out for. We can't do everything. So we do rely on our community partners to help us. So the direct programs that we actually operate as a county agency. So we have information assistance. So we have a call center. People can call, request information, whatever it is that they need help with. We have people that are there to help them. We have the Health Insurance Counseling and Advocacy Program, otherwise known as HICAP, which most people have heard of, which really provides the Medicare counseling and helps with other issues related to Medicare and Medi-Cal. So, sometimes people get bills that they shouldn't get, and so it's working on appeals. They come across a fair number of fraud cases, and so they work on those as well. So as part of their program, they have a benefit enrollment center. So what they found was that there's a lot of people that came to them for Medicare counseling, a lot of times weren't aware of the other benefits that they were eligible for. And so we work to streamline that access. And so if somebody comes in for Part D counseling, then if they're eligible for another public program, they'll actually help them there. It's not, go over to that other agency and they may or may not help you. It's, okay, we can help you now. We are one of 6 aging and disability resource centers in the state. An Aging and Disability Resource Center it's in line with our Information and Assistance Department, but it's a collaboration between our agency and the Independent Living Resource Center. So somebody can call their number, they can call our number, and we both will provide assistance to them. So we get a lot of younger people with disabilities calling saying, I want to live, independently. And they may be, 40 years old. That's fine. We can help them. Are we an expert in everything disability? No. But we'll call their staff, behind the scenes and get assistance. And that reduces people from having to make multiple calls to different agencies for help as well. As mentioned earlier, thank you, fall prevention. So fall prevention is one of those efforts that we've been after for years. Our fall prevention program is actually funded through the county, so it's not, federal or state money. Our emergency room physician at Ventura County Medical Center noticed an increase in the number of older adults that were falling and showing up in the ER. And a lot of them were with, traumatic brain injuries, fractures. And then he started wondering, why am I seeing, all these older adults? So he actually had somebody pull the records and figure out how many people were falling, and brought the data to the county and said, we have to do something. And so they set up a fall prevention program. And so we work with the EMS provider, so we get the data. So if somebody falls, essentially we know, because we see the ambulance report. And if you're stubborn and you don't go by ambulance, which a lot of people don't, because they think nothing is wrong, but later on, they tell their daughter, and they're like, you should have gone to the ER. So then they drive there. The hospital sent us a form saying, so-and-so fell. So we contact them. We have a social worker that works with individuals to really determine why you fell. So is it your house? Like, did you fall in the bathtub? Did you fall over, throw rugs, or your dog? Did you get dizzy, and faint? Like, what was it? And then for those that score very high with the likelihood of falling again, then we go out to the house and actually look at the house and see if the house is what's, causing it. And a lot of times the house is what's causing the falls. With that, because we were only focusing on preventing secondary falls, the community said, well, why aren't you preventing falls in the first place? Why are you only worried about preventing what they've happened? We said, you're right. We should be preventing it. So we rolled out a series of evidence-based fall prevention classes with a goal of trying to keep people healthy, active, moving, strong, hopefully to prevent falls. We have an elder abuse XC program, and what that is, it's a specialized case management program where we receive funding through the district attorney's office. So most victims of elder abuse that we come across are not in our system. So they've never called for help through information assistance. They've never received a meal. They've never received tickets for dial-a-ride or ride transportation. They are not in any of our community partner networks either. So these people are essentially off the grid that, show up, and there's some kind of, court case where they are the victim. And so typically what happens after, somebody goes through the criminal court process is that once the case is over, your time with the district attorney's office is over. The bad person's in jail. But what happens to somebody that's older and vulnerable that has to put their life back together? There is no one to help. And so that's where we come in. And so we have a specialized case management program that works with these individuals. We provide a lot of counseling, rides to court, and really it's connecting people back to the community. And we see, various, types of cases that come through this. A lot of it's, financial abuse from family members. Sometimes a large number of it's domestic violence. And it could be, the husband, the wife sometimes, or children. And sometimes, we do see like sexual assault cases as well that come through. But we're there long term. So after the case is done, they're part of our system. So we have more intensive case management. So I mentioned earlier birth through death, because that's really what we do. So we have a program that provides an alternative, two programs that provide alternative to nursing home placement. And so for one of the programs, it's for very high need individuals, and it essentially provides 24/7 in-home care, which you don't get unless you're in this program. But these are people that are on, ventilators, living at home, that need round-the-clock nursing care. And so we have, MSWs and registered nurses that are there in the home working with the family to keep the person out of a facility unless they decide that that's where they want to live. Transportation, it's a huge one. Last year, I want to say we provided like 93,000 rides, one-way trips. So we do that in a variety of ways. So one is that we have transit tickets from all of our transit agencies. And so we have people that are on subscription lists where we send regular tickets every single month. We have other people that don't need those transit tickets, but they're fine to take the bus. So we send the bus passes to them. Then we have people that need to travel out of county for medical appointments. Well, you're not going to take dial-a-ride out of county. So how do you get there if you don't have a family, member or friend that can take you, a neighbor? And so we provide the door-through-door to medical appointments out of the county. For in-county, if you're trying to transfer if you have to go from like Santa Paula to say Thousand Oaks, that's several transfers. And that's not I can get there in 45 minutes. That's like, it's going to take me hours and hours, half a day to get there and then to come back. And so we have a contract with Uber. So we Uber people. And then we also use other home care agencies to provide transportation as well to these individuals. Uber is not for everyone. So we make sure that if you have Uber, you can't have, a diagnosis of Alzheimer's or related dementia, because you have to be able to use a smartphone. And so, but we do have a fair number of people that go. But for our other transportation systems, you can go with a caregiver, you can go alone. The thing that's nice about those other transportation, providers is that they don't drop you off and then come back. They actually wait. And so they've been trained. They'll actually go into the doctor's appointment, not into the office with the doctor, but they'll take you into the lobby and they'll wait for you, which we think is a nicer, more humane level of care. So we have the home share program that's matching people that are looking for places with people that have an extra room. And sometimes it's they're exchanging money, which we're not involved with. So that's everybody's own deal is what they make of it. So it can be in exchange for money, and sometimes it's for services. So sometimes, like, I just want you to take me to the grocery store once a week. That works for some people. And sometimes it's like, can you do my yard work? So we do the background check on both of them because we want to make sure that both parties are safe and that we're not like hooking either up with like an axe murderer, that it's going to be like really bad if something goes wrong. So we do the vetting. Not everybody qualifies. There is screening, and there's certain things that disqualify people from participating in the program. So the Elder Help Program is a series of services that are geared to help people live, independently. So we provide homemaker service, chore service, personal care, as well, home modifications. We have funding so that sometimes if somebody gets behind on like an electric bill and their water is shut off, we can actually pay to have it connected. We've helped people with housing deposits before. But before we outlay money, we essentially want to make sure that this is a one-time thing, that you figured out your budget. So you're not going to be coming to us every single month saying, please pay my electric bill. And along with those services in the Elder Help Program is also we provide hoarding cleanup. So we work with code enforcement, adult protective services, and we get a lot of referrals for people that need long-term case management that have some hoarding going on. And so to participate in our hoarding program, you must agree to counseling. So we're not gonna clean up your place and then it happen, 2-3 years. So you actually have to work on, the emotional baggage of why you are hoarding before we pay to have your place cleaned up. I learned that from watching that hoarding show. It works though. We haven't had a problem with anybody that we've helped relapsing. And we also see it as like a housing program as well. If we can really, it's expensive, yes, to send a biohazard team out to clean up a place. But you're keeping somebody in a house. You're keeping them off the street. So we actually see it as a good thing. So senior nutrition, I think most people are familiar with. Home delivered meals, congregate meals, for people over the age of 60. For home delivered meals, you have to actually qualify. So there's an in-home assessment. It's not because you just want to be somewhere else and not at the senior center. You actually have to have a need for home delivered meals. With that program is one-on-one nutrition counseling with registered dietitians, and they do nutrition classes as well in the different communities. We have care transitions. So care transitions is somebody that's in a nursing home decides they don't want to live there anymore. And so we work with them to try to bring them back to the community. It's not an easy process, and it's really dependent on housing. So one of our new programs that we took on is employment training. So there's a federal program that provides employment training and subsidized wages for individuals that are very low income that are re-entering the workforce. So what we typically see with this is somebody that's like 65, 70 years old, has been out of the labor market for 30, 40 years, and because a spouse has died, they don't have the income to live where they're living, and they need to go to work. And so it's, updating a skill set that hasn't need to been updated because they've been doing something else. And so it's working with them really to get them the skills and work with them to actually get a job. And we have a pretty good success rate. And then we have caregiver services. So not everything is about older adults and people with disabilities. It's also supporting the caregivers who provide care for them. And so there's counseling and respite and home modifications, training, a whole set of other services that we can provide for caregivers, because really they're like the backbone of long-term care in this country. And if we can't keep them happy, engaged, then we cause a bigger societal problem. So we have contracted services. So we have some services for older adults and also for caregivers. So for the senior nutrition program, as a county agency, we run a couple of the sites, but we also contract out with most of the cities to do the program as well. We provide through contract legal services. So most people have heard of Gray Law that goes around and does the life classes and different things, different legal aid stuff. We provide funding for Gray Law. The long-term care ombudsman, who safeguards the residents in, the facilities, very important because we can't forget about them. So our mission is not just people in the community. We also have to look at people that are in institutional care and make sure that they are cared for and their rights aren't being violated. And so we provide the funding and oversight for the ombudsman program. We added an emotional support line maybe like 6 or 7 years ago, because what we found is that a lot of, and this goes back to the loneliness and isolation, we found that a lot of people were calling the agency, our call center, not because they had an actual question or help or needed help or a problem. It was because they were lonely. And it wasn't like just the occasional call. It was people would call every day, and it would be like 20, 30 minutes. How are you doing? And they would try to redirect them, like, why are you, what can I help you with? Well, there was nothing. They just wanted somebody to talk to. And as a county agency, it's a little more expensive place to be calling for, that type of, help. And so we worked with the advisory council, and it's like, what can we do? Like, we can't they need another service where that people can just call and just talk to somebody for as long as they want, and there be no pressure to hang up, and that's what they do. They'll just chat with you. And something where you can schedule a chat. And so if you are lonely every, Wednesday at noon, you can have somebody call you every Wednesday at noon and, have a regular chat. And so we provided funding to have the emotional support line, and that is run through the Camarillo Healthcare District. So for family caregivers, we have a total of 3 family caregiver centers in the county. So one is run by Senior Concerns here in Thousand Oaks, And so they cover the whole Canao Valley. The other one is at the Camarillo Healthcare District, and they're, you know, doing Camarillo and other parts of the country, the county. And then we have one at the Area Agency on Aging, but ours is focused on monolingual Spanish-speaking caregivers. And so we provide that service out in Santa Paula, Fillmore, Piru, and with, you know, residents of Oxnard. There are 3 separate centers, but we're working to make them a seamless one center where you can, you know, we don't care where you go for help, just go to one of the 3 centers if you're a caregiver. And so now we're working with the centers on, you know, developing shared marketing so that it's not confusing where people think it's like 3 separate types of service when really it's one. So those are some of the services that are provided: case management, training, support groups, home adaptations, respite, pre-placement counseling. And one of the things that we're working with the 3 centers on is increasing the dementia capability of staff. So we know that that's coming up more and more. How do we support people with Alzheimer's and related dementia in the community? You have to. You can't say, you know, there's not enough nursing home beds. And that's not what people want. And so we're trying to work to make the county more dementia friendly and to at least have our family caregiver centers appropriately trained so that they all can help families. And we work with the Alzheimer's Association with that as well. Okay, so back to our advisory council, which is my second favorite topic. So we do a lot of stuff as a county agency, and those are not like, I did not give you the exhaustive list of like every single program we run either. I could be here like days talking about what we do. So all of that stuff that we do, a lot of it comes out of the advisory council and the different committees that we have. So we have a health and nutrition committee, optimal aging, the transportation committee, a housing, a bylaws, planning and allocation, and our newest one is a workforce committee. Some of our best programs have come out of this citizen involvement. The home share program came out of our housing and transportation committee. It was, you know, another, like a small nonprofit was doing it in the city of Ventura. And they're like, can't we do this? Okay. You know, so we have it. Our whole transportation system that we have right now is all thanks to the advisory council and citizen involvement. They were the ones that said, this is a problem in the communities, what can we do? And we started small. We diverted some federal funding. It wasn't much. It was maybe like $10,000 the first year, and 10 years later, it's now, you know, has its own budget of like 400,000. But each year it kept on getting better because of, you know, the advisory council member saying that, you know, what about this? What about that? Can we add this component? Or this is not working. We need to address this. That's how we wound up with Uber. Our whole elder help program, too, is started at that as well. We were never in the business of doing homemaker chore, personal care, home modifications, any of that. It came up in a committee meeting. Can't you guys do this? And so sometimes we do if it's a countywide need. And if there's nobody else that can do it, then we will, as an agency, say, okay, we'll figure out a way to make this work. Okay, so for the public, if you want more information or to receive, you know, if you have questions, if you want help, we have our numbers here. Okay, so are there any questions? Okay. The phone number is, it's 805-47. Okay.
Second, so I can write it down.
In the meantime, I'm going to ask if any of the commissioners have any questions. Commissioner Guerra?
Thank you so much for that presentation. It was very informative, and I learned a lot, especially about the component about disability. So I wanted to ask just a little bit about that and about a couple of other areas that I'm particularly interested in that you may or may not have, access to. So the first thing about disability, what would you say then is how do you interact with tri-counties? So if I have a child that has a disability, what would be the difference between going to you versus going to tri-counties?
So if you have a child with a disability, one is that we would encourage tri-counties, like all the way. We work with tri-counties. And so one of the things that we're looking at is, so we have an Alzheimer's case management program. And so one of our two targeted populations are people with Alzheimer's disease that live alone. And then the other targeted population is people with intellectual developmental disabilities, because they have a much higher rate of developing Alzheimer's or related dementia than the regular population. And so we're working on, providing that outreach so that if there's somebody, like, let's say that's 35 and with Down syndrome, or somebody that's 40 with autism, then, they may be, clients of tri-counties, but we want to make sure that their staff is aware of what we do, because they don't provide the specialized case management dealing with behavioral symptoms of, Alzheimer's or related dementia.
So do you do that? So with regard to intellectual disability, do you do the same thing as ARC does? Or I know there's another program out there that does that in CME.
ARC does it, yeah, and I'm not sure of the other organization.
Oh, yeah. PathPoint.
Yes. No, so we don't duplicate what they do. We add on to what they're doing.
Okay.
Another way we work closely with all of those organizations is for our health insurance counseling and enrollment program. So the whole Medicare Part D, you need a review of what plan you're on. That affects people with disabilities as well, because many of them are on Medicare. And so we work with the staff of those programs and their social workers to run the plan comparisons to make sure that the medication is being covered.
So I've run across cases, and I don't know if your organization has, where there's a senior who has been taking care of a disabled family member or child. Have you had that experience?
Yes.
Okay.
Yeah, and that's weird. That's who we're targeting too. That we want to target those older adult caregivers of younger people with disabilities as well. And we don't see it as, we're not like, we go to great lengths to make sure we're not duplicating what other people are doing. We want to make sure that we're working together so that there's a more seamless system where people are not getting, lost or stuck somewhere. And so we do a lot of in-services with other organizations. Another one that we work with is, traumatic brain injury.
Yes. Okay. And I have just one more question, and that is regarding mental health and grief and loss. I know that you talked about the friendship line or the warm line through Camarillo Healthcare. Do you do anything else with regard to specifically dealing with grief and loss?
We are starting to. So we have a new program that we're launching, funded through behavioral health. And
great.
On our what we'll be starting, you'll notice if you ever call into our call center in the next month, you'll notice that there's a change in how we answer the phone. And so one of the things that we're doing is every caller, we're going to be asking them a two-set, it's called the PHQ-2. It's a patient health questionnaire.
Okay.
And so it's related to isolation and depression. And so we'll be asking every caller, it's not, are you depressed? It's, more of like, in the last 2 weeks, have you experienced, symptoms of blah, blah, blah. Depending on how people answer, then they'll be connected with a social worker who will do a longer screening. And then we're rolling out a case management program that's evidence-based specifically for people that have had grief loss, there's loneliness, but we're not talking like clinical. or people with severe and persistent mental health issues that need to go to a higher level of care.
That is awesome. I'm really happy to hear that you're going to be doing, and so that's going to happen in April?
We're in the process of hiring now staff for it.
That's exciting.
So we're onboarding our social workers and the rest of the staff of the program. But they'll be offering an intensive 8-week in-the-home program where they're working with somebody to, you know, address their issue and hopefully bring them through the other side.
Good luck with that program. I'm really excited to hear about that. Thank you.
Do we have any other commissioner questions? Commissioner Gett?
Thank you, Victoria, for a very excellent presentation. Can you make a few comments on the Master Plan on Aging and VC AAA's involvement?
Sure. So the Master Plan on Aging, for those of you who are not aware, is a governor executive order calling for all state agencies to work together to develop a 10-year plan of how we are addressing it's not just about older Californians, it's for everybody. So it's setting up a system that allows people to age in the state. So it's not a master plan on aging. They're purposeful, saying it's a master plan for aging. And that encompasses people with disabilities as well. They are, you know, they've been working on different groups. There's a statewide advisory committee. The report is due to the governor next October. We already knew this was coming because Senator Hannah-Beth Jackson is the one that introduced the original legislation calling for a master plan on aging. So as a county, we started planning before the state started what they were doing. So we as an agency are developing a separate plan for aging for Ventura County. And so there'll be input from all of the cities, different county agencies, but it will be similar to the state plan, but specific to what we need to do here in our county. And so we have a survey that's out right now where people can go on to our website and, you know, tell us what's important to them, what they need now, what they think that they're going to need in the future. We've been doing focus groups in different communities to receive input as well, to figure out what's important to people, because it's not the world according to what I think it should be. It's the people that actually, you know, you live here, use the services. It's what, you know, collectively we want to see in our county. And so that's going to go to the Board of Supervisors in probably April or May, and they'll adopt it, which will be before the state does theirs. So,
thank you. Any other commissioner comments? Commissioner Sylvester.
Hi. So I'm struck by the breadth of what you offer, and there's some great programs in there. What are your challenges in outreach, in letting people know that you have all these services?
It's a great question, and it's something that we've discussed for years, and it's, you know, we do the Live Well guide. We've tried all these different things, and what we found is that most people don't know that we're here until they need us. We don't necessarily want to do like a huge campaign where all of a sudden everybody's calling us, because we don't have the capacity to provide services all at once to all 205,000 older adults in the county. We don't have the resources to provide all of the services that people may want as well. We try to do it more, you know, targeted, to look at those areas that we know that are underrepresented, to make sure that at least we have, you know, participation there. But it's been thrown out. We'll do billboards or newspaper ads or, you know, commercials. And I think we discussed it, you know, earlier this week. You know, what do we do? But it has to be more. It has to be some kind of campaign where it's not, you know, we offer all this, call us now, but more just, you know, to plant the seed. Hey, there's an agency that helps with these issues, so that people at least remember. And then it's also, our name has also been like discussed. Well, maybe if you change it to something that it's easier to say or remember, then.
Thank you.
Any other commissioner comments? Anyone on this side? Well, I appreciate it, Victoria. The agencies, it's just incredibly important to our community, and hopefully this was a small way of sharing some information to the community so they're aware of what you have to offer. I appreciate it.
Thank you.
Great presentation. All right. Item 9 on our agenda is commissioner comments. These are just brief informational comments, no discussion. Anyone have a comment?
I do.
Commissioner Sylvester.
Real quick, you might have all received this in the mail, but the Canao Rex and Park District just came out with their catalog for their spring classes, including those at the Global Center, and priority registration opens up this Friday, March 6th at 6 a.m. So wake up early and sign up. Thank you.
Commissioner Burt.
Yes, hi. Real quickly, we have the Senior of the Year Awards Banquet coming June 4th. We're looking for nominations are now open, and they will close as of April 1st, and there are only 3 kinds of qualifications. You have to be 60 or older, a resident of Thousand Oaks or the unincorporated areas, and have volunteered 3 of the last 5 years in some sort of volunteer position. It's a great way to recognize a neighbor, a coworker, a friend. I hope to see some more nominations come through. Thanks.
Vice Chair Mortimer.
I have a couple of fun adult crafting dates to tell you about. One is Monday, March 30th, 6 o'clock to 7:30 p.m. at the Newbury Park Library. Come to the library for a fun evening spent learning how to make your own crochet Easter eggs. Patterns and yarn provided. Please bring your own size H crochet hook, and this is for beginners. The other one is Friday, April 24th, 3:30 to 5 o'clock p.m., Hedgehog book folding. This one's at the Thousand Oaks Library. Give new life to an old book by creating an adorable hedgehog. It's for folding beginners, and all supplies are provided.
Fun.
And it's fun.
Commissioner Belding?
Yes, I have something on, it sounds like it's a ways out, but it's so important. It's on Thursday, April 30. It is the second community workshop planned for the, it's our Thousand Oaks 2045 general plan update. It is a really fun time. There's lots of interaction, lots of discussion, and you get to participate in deciding what the Canao Valley is going to look like for the next 25 years in a fun, awesome way. And that's at the Los Robles Greens Sunset Ballroom, the evening of Thursday, April 30. Thank you.
Thank you. Commissioner Guerra?
If you didn't already know this and it's not marked on your calendar, don't forget to spring forward this weekend.
Oh, good advice. Yeah. We all forgot that. Yeah. Any other commissioner comments? If not, I have a quick one. On Saturday, April 11th, from 11 to 3 p.m. at the Thousand Oaks Library, we're going to have an Earth Day 50th anniversary celebration. It's for Arbor Earth Day 2020. They're going to be a family-friendly event, live entertainment, food, kids' crafts, environmental workshops and presentations, and raffles and giveaways. So I encourage you all to join us there. And with that, before I adjourn the meeting, I just have a couple quick announcements. Our next televised meeting will be April 1st at 1 p.m. Our guest speaker will be Kelly Tyndall from the County of Ventura, and she'll be discussing elder abuse. And in addition, we'll have a short presentation on the Climate Action Plan. So I'd like to invite everybody to join us here live, watch the televised broadcast, or watch online on TOTV. April 1st at 1 p.m. in this location. If you want any information on the Council on Aging or have any questions, you can call 805-381-7362 or email councilonaging@toaks.org. And with there being no further business, I will call the March 4th meeting to adjournment.